Pneumonia is inflammation of the lung, most often caused by either a bacterial or a virus. Pneumonia is usually documented in the medical record, but the specificity is rarely documented. Aspiration pneumonia and certain bacterial or all types of viral pneumonia often affect reimbursement. Patients with pneumonia exhibit a significant amount of symptoms related to the respiratory system: chest pain, cough, shortness of breath, sputum production, fever, and elevated white blood counts also support a diagnosis of infection. The chest X-ray is the standard diagnostic test for pneumonia. Findings of lung consolidation, opacicities, and patchy areas are often terms seen in a chest X-ray report of pneumonia patients. Aspiration pneumonia is often diagnosed by X-ray. Reports include right lower lung infiltrate on a chest X-ray. If a coder notes documentation of pneumonia and the X-ray reports right lower lobe infiltrate, this supports a query for aspiration pneumonia. The choice of antibiotics vary in aspiration pneumonia patients. Patients who have swallowing disorders are at high risk of aspiration pneumonia, or patients who have a nasogastric tube also are at risk for aspiration pneumonia. Post-stroke patients can have undocumented swallowing disorders, so be sure to review the chest X-ray when pneumonia is documented in the medical record. The most common viral pneumonia is influenza A, B, RSV, and HPV in children. Treatment is structured around supporting the signs and symptoms of the pneumonia, although there are a few drugs given for certain types of viral pneumonia, as we have provided in the list. Ventilator-associated pneumonia does not usually increase reimbursement when it occurs during the inpatient stay due to the fact it will be assigned a present on admission code of no. A CDI coder should know the hospital's CDI policy in regards to writing queries for conditions that arise during the hospitalization and are not present on admission. Query opportunities that have an increase in reimbursement pertain to patients who are receiving ventilator therapy prior to admission and have documented pneumonia on admission. Patients who are admitted with pneumonia and are placed on a vent for respiratory symptoms from pneumonia should not be queried for a diagnosis of ventilator pneumonia. A query for ventilator-associated pneumonia should only be written if the patient has been on the ventilator for more than 48 hours. Patients who are on chronic ventilation can aspirate and qualify for a diagnosis of aspiration pneumonia instead of ventilator-associated pneumonia. The CDI coder should look for documentation of aspiration before or during intubation, before deciding if a vent-associated pneumonia query is written. Coders are usually aware of the signs and symptoms of pneumonia. The challenge for the coder is in regards to querying is understanding the different types of pneumonias. Blood and sputum cultures are usually not helpful to determine bacteria, although physicians select the antibiotic treatment based on the type of pneumonia suspected. Therefore, when a coder writes a query for pneumonia clarification, knowledge of the antibiotic and the condition it is used for is very important. When the patient has pneumonia, but the sputum or blood culture comes back negative, it does not mean there is no opportunity for clarification. The query will be written asking the clinician if a diagnosis is probable or suspected based on the choice of antibiotics. Simple pneumonia, which is not usually a query opportunity, is often treated with doxycycline, Rocephin, Zithromax, Levaquin, or Avalox. If all cultures come back negative and the course of treatment is one of these antibiotics, there is most likely not a query opportunity. Medications and pneumonia types. Acyclovir usually covers herpes simplex virus or varicella zoster virus pneumonia. Amikacin is for gram-negative pneumonia. Avalox is for simple pneumonia. Cefepime is commonly given for Pseudomonas or gram-negative pneumonia. Ceftazidime is usually given for Pseudomonas or gram-negative pneumonia. Cipro is usually given for Pseudomonas pneumonia. Clindamycin is given for aspiration or anaerobes pneumonia. Doxycycline is often given for Legionella and simple pneumonia. Flagyl can be given for aspiration or anaerobes pneumonia. Fortaz can be given for Pseudomonas or gram-negative pneumonia. Ganciclovir is given for cytomegaloviral pneumonia. Gentamicin is given for gram-negative pneumonia. Impinim is given for Pseudomonas or gram-negative pneumonia. Levaquin is given for simple pneumonia. Alsamavar is given for influenza A or B if it's given in the first 48 hours of symptom onset. Ribavirin is given for RSV in severe cases. Rocephin is given for simple pneumonia, and tobramycin is given for gram-negative pneumonia. Vancomycin is also given for MRSA or Staphylococcus pneumonia. Zanamivir is given for influenza A or B, once again if given within the first 48 hours of onset of symptoms. And Zithromax is given for simple pneumonia. Zosyn is often given for aspiration or gram-negative pneumonia, and Zyvox is given for MRSA pneumonia. Common clinical indicators for pneumonia include chest pain, chills, cough, crackles of the lung, cyanosis, current long-term respiratory ventilation, decreased breath sounds, dyspnea, an elevated white blood cell count, fatigue, fever, hypoxemia, nasal congestion, nasal flaring, pharyngitis, pleural effusion, rhinorrhea, shortness of breath, sputum production, tachycardia, tachypnea, and wheezing. Common diagnostic tests for pneumonia include blood culture, chest x-ray, complete blood count, and sputum culture. And common therapeutic treatments of pneumonia include antibiotics, antivirals, breathing treatments, coughing and breathing exercises, IV hydration, and suctioning of sputum. Possible for query options for pneumonia include aspiration pneumonia, pneumonia due to Enterobacter gram-negative, pneumonia due to influenza A, pneumonia due to influenza B, pneumonia due to herpes simplex virus, pneumonia due to Klebsiella gram-negative, pneumonia due to MRSA, pneumonia due to Pseudomonas gram-negative, pneumonia due to RSV, pneumonia due to varicella zoster, ventilator-associated pneumonia.